Hey everybody, welcome. Happy Friday, everybody. Happy Friday. I'm going to give a few minutes for everybody to jump jump on. If you're having any computer issues, I'm going to give you a few. My name is Phyllis, and welcome to Florida Training. Today we will be talking about infection control practice exam for CNAs. So welcome everybody. Welcome. Happy Friday, happy Friday, happy Friday. Give everybody a few minutes, few seconds rather to chime in on today's lesson. Hi. So this month is Thanksgiving month, and anybody ready to eat? I'm ready to eat already and give my thanks. Hey. All right, ladies and gentlemen, once again, my name is Phyllis. I will be your instructor for tonight. We will be covering the practice exam for CNAs, infections control. All right, let's go ahead and dive right into today's lesson. All right, what is recommended frequency for parenteral care in patients with indwelling urinary catheters to prevent infections? That's just something out there. Let's go ahead and get started. You will use standard precautions in situations where you are A. Bathing a resident with a raised red rash, B. Cleaning a set of dentures, C. Removing used linens from a resident's bed, D. All of the above. Go ahead and drop your answers in the chat on this Good Friday. Drop your answers in the chat on this Good Friday. Is it A, B, C, or D? You will use standard precautions in situations where you are A, B, C, or D. All right, I see a lot of D's. Let's go ahead and dive right into the answer. Let's see. If you chose D, you are absolutely correct. All of the above. Any task during which you may have contact with open areas of skin, blood, or body fluid, or mucous membranes requires the use of standard precautions, which includes hand washing and the use of personal protective equipment. Way to go, guys. Patients who are being ruled out for or have tested positive for tuberculosis should be placed on blank precautions. A, airborne, B, protective, C, COVID, D, enhanced. Patients who are being ruled out for or have tested positive for tuberculosis should be placed on blank precautions. A, B, C, or D. A, B, C, or D. All right. All right, let's go ahead and dive right into the answer. If you chose A, airborne, you are absolutely correct. Tuberculosis is transmitted in airborne particles called droplets nuclei that are expelled when persons with pulmonary or laryngeal TB cough, sneeze, shout, or sing. The tiny infectious particles can be carried by air currents throughout a room or building. Therefore, use of specialized masks, which is the N95, in a negative pressure room are needed to prevent the spread of this airborne illness. Way to go, guys. Which of the following symptoms is often an early sign of infection in patients? A, fatigue, B, nausea, C, muscle aches, D, sudden chills. Which of the following symptoms is often an early sign of infection in patients? A, B, C, or D? Go ahead and drop your answers in the chat and let me know what you think it is. If you are just now joining, my name is Phyllis and welcome to Florida Training. Today we are doing a CNA practice exam for infection control. And if you missed the first questions or the first part, you can always go back if you like, subscribe to see the video. Hello, hello. All right, let's go ahead and dive right into the answer. If you chose answer D, you are absolutely correct. Sudden chills. Sudden chills are radars are often an early sign of infection, indicating the body's initial response to pathogens. Fatigue, nausea, and muscle aches may develop later as the infection progresses. As you are changing the linens on your patient's bed, you accidentally get stuck with a needle that was left in the patient's bed. You must blank. A, report it to the nurse. B, quickly wash your hands with lots of soap and water. C, report the needle stick injury the following day. D, both A and B. Which one do you think it is? I'd have gave the answer. Sorry, guys. But if you chose answer D, you are absolutely correct. Both A and B. Exposed needles are considered contaminated. When you stick yourself with the needle, you must immediately report this to the nurse and wash your hands with lots of soap and water. All right, moving right along. The single most important thing that all healthcare workers can do in order to prevent the spread of infection is blank. A, following standard precautions. B, proper hand washing. C, using gloves. D, isolating the patients. The single most important thing that all healthcare workers can do in order to prevent the spread of infection is A, B, C, or D. Drop your answers in the chat. Drop your answers in the chat. Drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose B, you are absolutely correct. Proper hand washing. Proper hand washing is the single most important thing that you can do in order to prevent the spread of infection. Standard precautions, the use of gloves when needed and isolation when needed, also prevent the spread of infection. But hand washing is the single most important thing that you can do to prevent the spread of infection. All right. The most important part of the hand washing procedure is A, using the hottest water you can tolerate. B, using only antibacterial soap. C, using adequate friction. D, taking a full 3 minutes to wash your hands. The most important part of hand washing procedure is A, B, C, or D. Drop your answers in the chat. Drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose answer C, you are absolutely correct. Using adequate friction, rubbing hands together during routine hand washing is the most effective way to remove microbes. Water should be warm but does not have to be uncomfortably hot. Soap does not have to be antibacterial to be effective if a proper hand washing technique is utilized. Hands should be washed for a minimum of 15 to 20 seconds for the lathering and the friction of all surfaces of hands, fingers up to one's hand width above the wrist. All right, you guys, way to go. Which of the following cannot be treated with an antibiotic? A. Syphilis. B. Gonorrhea. C. Shingles. D. MRSA. Which of the following cannot be treated with an antibiotic? Drop your answers in the chat. All right, I see some C's, D's. All right, let's go ahead and dive right into the answer. Shingles. If you chose C, shingles, you are absolutely correct. Only bacteria can be treated with antibiotics. Shingles is a painful rash that is caused by the same viral infection that causes chickenpox. The other answer options are bacterial infections and can be treated with antibiotics. All right, Mr. Daly has a non-neurovirus infection. Which of the following interventions is not effective against neurovirus infections? A. Hand washing. B. Alcohol-based hand sanitizer. C. Contact precautions. D. Bagging soiled linen at the bedside. Drop your answers in the chat. Let me know what you think it is. If you are just now joining, we are going over infection control for the practice exam for CNAs. All right, let's go ahead and dive right into the answer. If you chose B, you are absolutely correct. Alcohol-based hand sanitizers. Norovirus is a very contagious virus that causes vomiting and diarrhea. It is resistant to alcohol-based disinfectants, soap, water, and friction are necessary to remove the virus. Contact precautions are indicated in following facilities. Procedures is essential to halt the spread of this very contagious virus. You must wear gloves when you are blank. A. Preparing infant formula for a newborn baby. B. Transferring breast milk into a baby bottle. C. Knocking on a patient's door. D. Opening a patient's door. You must wear gloves when you are blank. A, B, C, or D. Drop your answers in the chat. Drop your answers in the chat. Let me know what you think it is. All right, I see some A's and B's. All right, let's go ahead and dive right into the answer. If you chose B, you are absolutely correct. Transferring breast milk into a baby bottle. Breast milk is considered a bodily fluid, so you must wear gloves when you are transferring breast milk into a baby bottle. It is not necessary to wear gloves when you prepare infant formula because formula is not a bodily fluid. Lastly, you do not have to wear gloves when you knock on or open a patient's door. What is the purpose of personal protective equipment, better known as PPE? A, to protect the patient from the spread of diseases. B, to protect both the healthcare provider and the patient from being infected with diseases. C, to protect the healthcare provider from the spread of diseases. D, to protect equipment from being compromised. Drop your answers in the chat. Drop your answers in the chat. A, B, C, or D. Let's go ahead and dive right into the answer. If you chose B, you are absolutely correct to protect both the healthcare provider and the patient from being infected with diseases. Personal protective equipment, commonly referred to as PPE, is equipment worn to minimize exposure to hazards that cause serious workplace injury and illness. These injuries and illness may result from contact with bodily fluid, chemicals, and other workplace hazards. Way to go, guys. Which of the following is not a common sign of infection in patients? A, fever. B, swelling. C, decreased heart rate. D, redness and warmth at the site of infection. Which of the following is not a common sign of infection in patients? A, B, C, or D. Drop your answers in the chat and let me know what you think it is. All right, I got some C's and B's. Let's see, C's and B's. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Decreased heart rate. Fever, swelling, redness, warmth at the site of infection are all typical signs of infection. Decreased heart rate is not typically associated with infection. Instead, an increased heart rate, tachycardia, is often observed as the body's response to infection. Way to go, guys. A stigmatic sign of infection is A, swelling. B, redness. C, heat. D, fever. Drop your answers in the chat and let me know what you think it is. Drop your answers in the chat. A systemic sign of infection is A, B, C, or D. Drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. Fever. The signs and symptoms of infections can be local and systemic, are body-wide, and more diffuse. Some of the systemic signs of infection include a loss of appetite, rapid pulse, fever, and a high white blood count. The nurse tells you Miss Kramer's pressure ulcer is not healing because it is covered with a biofilm. A biofilm is best described as an easily identifiable pathogen. B, colonies of bacteria with a strong sticky outer coat. C, an airborne pathogen. Or D, a protozoa. I think I said that properly. Drop your answers in the chat. Let me know what you think it is. Drop your answers in the chat. It's actually protozoa. I pronounced it incorrect. D, a protozoa. All right, let's go ahead and dive right into the answer. If you chose B, you are absolutely correct. Colonies of bacteria with a strong, sticky outer coat. Biofilm can affect chronic wounds such as pressure ulcers. It can be difficult to identify and to treat. Which vital sign is typically elevated in response to an infection? A, blood pressure. B, respiratory rate. C, oxygen saturation. D, temperature. Which vital sign is typically elevated in response to an infection? A, B, C, or D? Drop your answers in the chat. Let me know what you think it is. All right. Oh, I see a lot of D's. Let's dive right into the answer. All right, way to go, you guys. If you chose D, temperature, you are absolutely correct. Fever, indicated by an elevated body temperature, is a common response to infection. While changes in blood pressure, respiratory rate, and oxygen saturation can occur secondary to severe infections or complications, they are not typically the primary vital sign affected by infection. Way to go, guys. The nursing assistant is selecting the appropriate personal protective equipment, known as PPE, attire to wear prior to delivering care to a patient who has been placed on contact precaution. If which of the following items will be worn? A, gloves and gown in a gown. B, gloves, gown, and a face mask. C, gloves, gown, a face mask, and a face shield. D, gloves, gown, a HEPA mask, and a face shield. A, B, C, or D? Drop your answers in the chat. Let me know what you think it is. If you chose answer A, you are absolutely correct. Gloves and a gown. Contact precautions require the use of gloves and a gown at the very minimum. Droplet transmission precautions require the use of medical face masks at the very minimum. Airborne transmission precautions at the minimum require the use of a negative pressure room and an N95 mask, also known as particular respirator. I would wear a face mask as well because I'm mature. Some people still do. It's totally up to you. All right. Which of the following is not a bodily fluid? A, tears. B, feces. C, saliva. D, emesis, which is vomit. E, none of the above. Which of the following is not a bodily fluid? All right. Congratulations, Richard. Congratulations. Way to go. Congratulations. I wish I was in Jamaica right now. The temperature's starting to drop here in Florida. Drop your answers in the chat. Which of the following is not a bodily fluid? A, B, C, or D, or E? All right, let's go. I see a lot of E's. Let's go ahead and dive right into the answer. If you chose E, you was absolutely correct. None of the above. Tears, feces, saliva, and emesis, which is vomit, are all considered bodily fluid. Which of the following symptoms is commonly associated with a respiratory infection? A, polyuria. B, hematuria. D, I think I'm going to say this wrong, so just bear with me. Dyspnea. D, jaundice. Let's see. Drop your answers in the chat. Dyspnea. That was close. Drop your answers in the chat. A, B, C, or D. If you chose C, you are absolutely correct. Dyspnea. Dyspnea or difficulty breathing is a common symptom of respiratory infections such as pneumonia or bronchitis. Polyuria and hematuria are symptoms associated with urinary tract infections, while jaundice is typically indicated of liver or gallbladder issues. Which of the following is a common risk factor for urinary tract infections, UTIs, in elderly patients? A, high fluid intake. B, regular voiding schedule. C, immobility. D, low sodium diet. Which of the following is a common risk factor for urinary tract infection in elderly patients? A, B, C, or D? Drop your answers in the chat. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Immobility. Immobility, which can lead to urinary retention and incomplete bladder emptying, is a common risk factor for UTIs in elderly patients. High fluid intake and regular voiding schedule are typically preventive measures for UTIs, while a low sodium diet is unrelated to UTI risk. When you have cleaned up a broken blood tube which was dropped in your patient's room while you were performing care, what do you do now? A, let the nurse know so the blood can be redrawn. B, let housekeeping know so that additional floor cleaning can be done. C, nothing further as you follow procedure and policy in the cleanup. D, both A and B. Drop your answers in the chat. Drop your answers in the chat. Drop your answers in the chat and let me know what you think it is. A, B, C, or D. All right, I see a lot of D's, see some B's. Let's dive right into the answer. If you chose D, you are absolutely correct, both A and B. This type of spill needs to be attended to in many departments and has many ramifications, which your presence and actions can assure all are covered. The nurse or phlebotomist will redraw the blood. Housekeeping needs to conduct additional floor cleaning to ensure there is no residual glass or blood. Answer option C is incorrect because while policy and procedure has been followed as far as your cleanup, you should notify the nurse of the incident. Which of the following symptoms is not associated with tuberculosis disease? A, night sweats. B, hemotis. I'm sorry, y'all. Hemotis. C, weight gain. D, fatigue or weakness. Drop your answers in the chat and let me know what you think it is. Hemotesis. And it's actually hemoptysis. I'm sorry. All right, let's go ahead and drop the answers, and I'm going to dive right into the answer. If you chose C, you are absolutely correct. Weight gain. Weight loss is associated with tuberculosis disease. I cannot say this word for nothing in the world. It's spitting up blood. Hemoptysis is spitting up blood. There we go. Which of the following actions by a CNA can contribute to prevention of catheter associated with associated infections? A. Keeping the catheter tubing below the level of the bladder. B. Encouraging the patient to increase their fluid intake. C. Avoiding hand hygiene before and after catheter care. D. Securing the catheter tubing with tape to prevent movement. A, B, C, or D. Drop your answers in the chat and let me know what you think it is. A, B, C, or D. All right, let's dive right into the answer. If you chose answer A, you are absolutely correct. Notify the nursing supervisor immediately. Recognize signs of CAUTI, such as fever, cloudy urine, or foul odor, is crucial. Reporting these signs properly allows for timely assessment and appropriate intervention by healthcare professionals. Which of the following actions by a CNA can contribute to the prevention of catheter-associated infections? A, I'm sorry, y'all. Why is this? I'm so sorry, y'all. There we go. I'm sorry. B, encouraging the patient to increase their fluid intake. Adequate hydration promotes urinary flow and helps flush bacteria from the urinary tract, reduce the risk of catheter associated. I'm sorry, I don't know what just happened. My computer doing something strange. Why is mouth care important? A, bad breath is unpleasant to be around. B, bad oral hygiene can lead to malnutrition. C, infected teeth and gums can spread infection to other parts of the body and to the blood, causing infections and sepsis. D, all of the above. Why is mouth care important? A, B, C, or D? All right. Let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. All of the above. Halitosis, bad breath, is unpleasant to be around and may cause a person to be avoided by others. Bad oral hygiene changes how foods taste, and in the ill and elderly, this may cause them to stop eating, leading to malnutrition. The bacteria in the mouth can cause stiffness, infections, and sepsis if left untreated. Is there a correct order to follow when putting on PPE? A, yes. B, no. C, yes, but only when my supervisor is looking. A, B, C, or D? A, B, C, or D? Drop your answers in the chat. All right, let's go ahead and dive right into the answer. All right, explanation. So it's 1 gown, 2 masks or respirator, 3 goggles of face shield, 4 gloves. C. And you guys can always go back to take a look at this video if need to be. Or you can always subscribe on floridatraining.com. floridatraining.com. You can always go back and go to floridatraining.com if you are just now joining and you need to go back and review any of the video, the beginning of the video. You can always go back. All right, let's move right along. What is the recommended frequency of perineal care in patients with indwelling urinary catheter to prevent infections? A, once a week. B, every 12 hours. C, every 24 hours. D, only when the patient complains of discomfort. A, B, C, or D. A, B, C, or D. Drop your answers in the chat. All right. Dive right into the answer. If you chose answer D, you are absolutely correct. Every 12 hours. Performing perineal care every 12 hours helps maintain cleanliness and reduce the risk of catheter-associated urinary tract infections. All right, great job, you guys. Please like, subscribe, Florida Training Academy. You can always go to www.floridatraining.com. Happy Friday. Like I said, you can always go back on the YouTube, subscribe, and you can always go back to the beginning of the video. If you missed anything, if you would like more practice, please be on the lookout for me next week. You guys have a wonderful and safe weekend, and happy Friday again. Have a good evening.